Hi, everybody. This is Monica, the Femtech Summit organizer. So we are starting our Q&A session in 10 minutes, and I'm so excited to have our guests come on very soon. I wanted to jump in a little quicker. I am waiting for everybody to be joining right now, but just wanted to say how grateful I am for your presence here and for being here and sharing with us. So the summit is for you. Right? So we're taking our health in our hands, and welcome everybody who's already here. I just wanted to say, jump on right away, ask questions. You can type your questions in the comments right underneath this video on YouTube. And also you can request to join live. And if you want to join live, just click on the link here that I posted in the comments. So please be there. We're here to support you and answer your questions. So our summit speakers are going to be coming on soon in about 9 minutes. And so just wanted to say hello, welcome. I'm so excited to have you and going on that ride with me. I always appreciate your feedback and your questions. So never hesitate to reach out to me. You can email me right by answering to any of the emails you get from us, and just connect. So I will be sending you more messages to make sure that your experience is what you wanted and that we are actually answering the questions that you want to have answered. Okay, so we're just going to be waiting for the summit speakers, and I'm going to pause this recording and come back in a few minutes. Hello. Just waiting on people and just encouraging everybody to post your comments in your questions in the comments. I'm going to be starting very soon. Hello, Dr. Shay and Rob Besner. Welcome back.
Yeah, I'm trying to see if I can zoom my camera out. Not quite sure why I'm so zoomed in.
You got a big nose. It looks pretty good.
Yeah. Better
just like me.
Better questions. I know.
Let me
I'm
see
the same
what
way.
I think this may be better.
Let me try. Let me switch. There we go.
Yeah, there we go. Okay. Cool.
Well, yes, we got it. We got it. Well, thank you. This is great. I mean, we're going to be starting in a minute. We see here people watching. So I hope everybody watching can actually see your comments. So the way we go about it is please post your questions in the comments. But I also posted a link. If you want to jump on live and actually ask your question in person, you are welcome to. Let me repost that link for you here. Let's see if we can do it. You're welcome. Please don't be shy. Alrighty, great. Well, beautiful. Well, let's get started, and we can get started by, I would love for you just to tell us in 2 sentences about yourself and what you work with and what kind of questions would you like most to answer today?
Take it away, Robbie.
You want to take it away, Doc?
No, you do it. You're all good.
Okay, I'm Robbie Besner. I'm the CEO, device developer for a company named Therasage. And we specialize in harnessing full spectrum infrared frequencies from sun. And we put them into various different systems or platforms. One is an infrared sauna, and the other is an on-body experience that we call a healing pad. And then we create a series of health science applications or protocols to optimize the customer or patient's experience with our devices. We've been integrated in healthcare, mostly in infectious disease for the first 15 years. Our company is about 22 years old. And the last 5 or 6 years, we've been focusing on optimal health, which is really exciting for us because well, I don't know if you guys can share the experience, docs, but it's kind of a little bit on the easier side to help someone that's got a chronic challenge, to help them start to feel better or less symptomatic. It's a whole different thing when you've got a Tom Brady or one of these, high-end athletes, to keep them optimal, help them repair or maintain the integrity of their performance, or even dial it up even further. So that's very exciting to me, because I would rather teach people to stay healthy rather than get sort of behind the 8 ball when they're already symptomatic, and try to get them catch back their health, keep them vital, keep them healthy. And that's really very exciting for me in terms of moving forward.
Beautiful. Okay, I just want to welcome Dr. Amy Beckley joining us as well. Welcome, Amy. And I was just asking our guests today to just say briefly about, what your focus of expertise is and what kind of questions would you like to answer most today?
Yeah, so thanks for having me. I have a PhD in hormone signaling, and I just love reproductive biology. I help couples figure out why they're not conceiving, and have created a diagnostic testing system for everything that involves everything but timing, right? You take care of the timing, we'll take care of everything else. So we have everything from sperm testing kits to making sure she has proper ovulation, test egg count. So questions I like are, why am I not getting pregnant? When should I start, thinking about fertility? Infertility is so common now that almost everyone faces it or knows somebody that's affected. I had my own personal battle, went through multiple rounds of IVF. Turns out I actually didn't need IVF. So I was trying to teach people the secrets of fertility to try to save them from expensive procedures that they could use the money elsewhere.
Yes, thank you so much, Amy. And we're going to be featuring Amy tomorrow as our expert speaker too. So, and Dr. Shay, tell us just, in one sentence, and what kind of questions would you like most?
Sure. My name is Dr. Samuel Shay. I'm a chiropractor and certified practitioner with the Kalish Institute for Functional Medicine and the Institute for Functional Medicine. And I'm basically a health mutt. I've got a combination of multiple different trainings, ranging from functional neurology, functional medicine, acupuncture, adjusting, physical medicine, nutrition, osteopath, trained by an osteopath as well, just mixing it all together. And right now, I'm an online concierge functional medicine practitioner, and I help busy, health conscious women transform their energy, hormones, gut, and brain so they can have more time, focus, and energy for themselves, their businesses, and their family. The questions I love to hear are, why is it I can't lose the puffy weight? How do I best recapture my health and vitality now that I've had a couple of kids, or I'm entering middle age, or I'm post divorce and I want to get my my mojo back? And I also want to field questions on how is it that functional testing, particularly functional medicine and functional genetics, can be used as a deep dive femtech to look at where is my biochemistry damaged and exactly what labs I should be looking at in order to help me get back to not only baseline but to optimal.
Beautiful. Okay, so let's get started. We have a question from Allison, and I think this is a question that a lot of women probably are asking. So, what can I do or understand about how when I'm tired, I'm more hungry, but eating makes me more tired because I have digestive problems and celiac? So it's a loop. So I think if we can go in a circle, see who wants to answer this, and maybe
Can I
give
clarify
our
the question?
perspective.
So, can I clarify the question? So, when she's tired, she's hungry, but when she eats, she gets more tired. Am I hearing that correctly? Is that
Yes.
Is that
And she also says that because I have digestive problems and celiac.
how you want to do, clockwise or counterclockwise, Monica?
Oh, you know what? Whoever wants to jump first, please go ahead.
I'll jump in since I'm yakking away. So when I hear that someone is hungry when they're tired, a couple thoughts come in. Obviously, everything has to be verified through testing, at least through my lens. If someone's tired, then that can mean a couple things. One is that their adrenal regulatory blood sugar system is out of kilter. So if their blood sugar is dropping, either from an altered adrenal system or from an altered insulin blood sugar control system, their blood sugar is dropping and it sends a signal to the brain that they're needing fuel. But if they're more tired after they eat, that may be in conflict then with meaningful digestive problems, like she's mentioned, like celiac, if it's an inflammatory issue or a gut infection issue or both, that whenever you eat, it's creating an inflammatory response, which is then creating more biochemical burden, which then creates more fatigue to clear the inflammation. I think in the talk I described earlier this morning, that if my arm, this is my arm and this is my finger, and I poke my arm, but my arm is fine, my finger just bounces off. But if I have an open wound on my arm and I poke it, do I have a finger allergy? No, I have an open wound that's being irritated by my finger. So if I have an inflammatory process in my gut, or an open wound in my gut like celiac, and I eat any food, and the food hits an open, irritated piece of intestine, my body's going to have to mobilize a very metabolically expensive immune response to try to mitigate the damage caused by just trivial eating. And that metabolic response is going to cost a lot of energy, making you more tired. Those would be the two things that come to mind.
Yes. So, like, what is the first thing that maybe she could do if anybody wants?
And anyone who's got a complex health concern like celiac should work with a professional and looks at the big picture, looks at lifestyle, looks at testing, and then can create a customized plan for them, because it's not this is not a simple case of, well, just take this special brand of goji berry juice. You can just inject up your nose and everything will be great. It's not like that. People with a complex health concern need to work with a skilled practitioner that can actually investigate all the multiplicity of things that can be involved, and then also understand all the tools that can be brought in once you have proper analysis. Whether it's like red light therapy, which I'm a huge fan of, and you've known about since 2005. And red light therapy is one great way to help. And so there's all sorts, you can leverage all these different tools that you know about, but have a quarterback, have someone who can actually read the field and understand which special teams you need to bring in.
Okay, great. Rob, would you like to say more about the infrared therapy and how would you help Allison with this question?
Well, energy medicine is our category, so we've been actually working on that for quite a while. So I agree with Dr. Sam. He's spot on there. Where I went, just from an empath perspective, was leaky everything, like people are experiencing, because we're getting trace elements of glyphosate in food, water, and air now, that everything's leaking. And so, to piggyback on your expression of some kind of inflammation, oftentimes if it's stimulated by food and that undigested food or bacteria is leaking into your system, then it's triggering that inflammatory response. And so that's there's some very simple solutions. Dr. Zach Bush, a friend of ours, created a simple solution that you just, or answer to that you can, because the GI tract, those cells, the what are they called? Tight junctions, right? Those linings of your GI tract, they regenerate in 3 or 4 days. And so you can take humic and fulvic acid solution. He calls his ionic biome, I believe now is the name of his formulation. And you just take a teaspoon before your meal, and it kind of creates a better or stronger lining of the inner gut. Then now we're not creating that leaky situation, creating the inflammatory response. And so I would go there first, simply because it seems to be fairly prevalent now in what we're seeing in all of our clinics. And so, within a week or two, you can discover if that seems to be one of the root causes, to just lower that inflammation. That buys the patient and the lead practitioner, time to actually go dive deeper into maybe one of the complexities or other complexities that might be influencing. But aside from that part of it, using red light or infrared, full spectrum infrared, like we're doing, is another simple way for you to at least cool down, cool down the flame, put water on the fire, so to speak. So again, buying time for the patient to get part of their life back and not have to deal with that challenge that's interrupting their lifestyle per se, while their team practitioner can actually, unravel whatever situations might be at play.
Allison's actually saying, haha, leaky everything. You're right. I have leaky energetic boundaries too. And I think that is speaking to something that, mind and body that do come together. And we spoke about that today already. Amy, do you have anything to add to that?
Not really. I mean, the only thing I would say is if you're trying to conceive, your menstrual cycle is the first thing to go. And so if you have all this inflammation and this problems in your system, you probably will have a messed up cycle as well. And so even if you're not trying to conceive, looking at the cycle, is it regular? Do you have, regular periods? Are they heavy? Are they clotty? If you have painful periods, those are all kind of symptoms that you can say there's something not quite right in the system. But other than that, these guys got it nailed. So
yes, well, thank you. And actually, Amy, I did have a question for you that came earlier from a viewer. She was asking about harnessing the energies during different stages of the cycle, and actually really understanding and utilizing our menstrual cycle as women properly to understand our work times, rest times, energy in the body. What would you say about that?
Oh, absolutely. I mean, there's so much beautiful research
Mhm.
about the power of the menstrual cycle. The middle of the cycle, when estrogen is highest, is when you're more creative, you're more energetic, but also your joints are more fluid, so you're prone to more injury because you feel like you can run faster and do more, and then you tend to injure yourself. But scheduling different things around your menstrual cycle, so when you're actually bleeding the first few days of your cycle, that's a time to rest, eat warm foods, kind of take it easy, do yoga, do meditation. And then as estrogen starts to build, that's when we take on more complicated tasks. That's when you want to have strategic meetings. You want to schedule events where you're out in the public and you're meeting people. And then in luteal phase, when your progesterone starts to rise, this is when you can actually get things done. And so you've had these meetings, you've got this strategic plan. This is the time to go and do it, and plan out and check off your list. So yeah, it's called cycle syncing. There's a whole bunch of information about what you should eat during this time, how you should exercise during the time, and then how you should plan your activities to maximize your hormones to their full benefit.
Okay, great. And where's the best first step to actually start to unravel that, understand the cycle?
There's a book from Lisa Henderson Jack called The Fifth Vital Sign. And that really talks about the menstrual cycle and how powerful it is. You can just Google cycle syncing, cycle phases. There's actually a couple apps that can help you look at your cycle. You have to be careful because they all use the calendar, and using the calendar method is just, it's not as good as actually measuring hormones themselves. If you really want to know what's going on, you should measure hormones, which is what we do, because a lot of times the apps make it too simple and they miss certain things that women are experiencing. And so, we haven't really tapped into the cycle syncing and using hormones as a superpower to plan out your day. But we more use them for finding cycle irregularities, hormone imbalances to help women conceive.
Great. And I know we'll be talking more about that tomorrow too. So beautiful. Did you, well, let's see, we have many other questions. So let's maybe move on. Well, one quick question to Rob from Ruby. She's mentioning she would like to know more about other products you have because she cannot afford the sauna yet. What would you suggest?
Well, actually, I wanted to mention this earlier. We make an on-body full spectrum, what we call a healing pad. It comes in different sizes, but it's terrific. And for women, when they are going through when they're menstruating and they're experiencing pain, particularly. And I have testimonials from guys that have told me that I've saved their marriages and I've saved their relationships because their spouses or their girlfriends were in so much pain that it was actually affecting their relationship in a sense. This healing pad is looks like a heating pad, but it uses full spectrum infrared frequencies. There's no electromagnetic fields. They're very affordable. In fact, I think the lowest entry price is just a little bit over $100. So it's a lot of money, but not outrageous a lot of money. These are the devices that we make are classified as Class 2 medical. So we have FDA clearance. So we have practitioners that are part of our team that recommend. They're also considered durable medical equipment. So if your primary doctor writes a prescription for these devices, you can bring it to a durable medical equipment dispensary, get the equipment for free, and then the government reimburses the DME for the equipment. So it's sort of affordable and very easy to get into your home and get into your life. And certainly there's one application when you're menstruating, you're in pain, but for stress relief, if you just put it, I don't know why this is, and maybe it's not just for women, but certainly we hear this a lot in clinic that women express their stress, they hold it between their shoulders. And if you put this little healing pad, which is the size of a computer page, 8 inches by 10 inches, right between your shoulder blades, and put it on just a mild heat. You just can feel your stress melting away. So for improved, we're clear to talk about by FDA, improving circulation, better sleep and rest and relaxation, lowering stress, and improving blood oxygenation. So these are medical devices, but they're designed for in-home use. They're low entry, and in terms of expense to get in, they come in different sizes. So we make them for larger people too, and to cover more space. And we make one actually the size of a full treatment table that many physical therapists and occupational therapists, chiropractors use it prior to an adjustment to warm the body up so their structural systems are more relaxed. And we find that the adjustments hold a lot longer because their bodies are more easily malleable. And then the practitioner will use it in practice and then dispense the small little pads for people to use at home. So it's really nice, affordable, and a great solution.
Okay, great. So another question about, well, actually we have a question about testing, which is very broad, and we'll see how we can address it. So our viewer who says she's 75 years old, and she's asking what testing would be a priority?
So that's where you have to analyze, go to a practitioner that analyzes your whole history and lifestyle, past and present first, before just handing out tests. So if it depends, what's the priority? Well, first off, there may be a multiplicity of priorities. So if someone's got, ongoing neurodegeneration or the fear of it, because they're seeing, like, they have family members, if they're 70, but my father's going through dementia right now, and dementia is not simply a singular test issue. If you were to really try to pick one thing, it'd be is the most advanced mitochondria brain liver analysis via organic, broad spectrum organic acids testing as you could possibly do, because the primary issue with dementia is a breakdown of mitochondria. But then there's multiple types of dementia. Like there's infectious dementia, there's toxic dementia, there's inflammatory dementia, there's there's brain damage based, concussive based dementias. There's I think I mentioned toxic dementia already. There's also, because then you may have to do like a Lyme test or a mold metals test or broad infection test. You may have to go see a functional neurologist to work on, concussions. There's all sorts of tests that might be relevant. Even if someone says, "Oh, I have gut problems, I need a gut test." Yes, and there also may be other issues that are converging on the gut as well. For example, if your adrenals are super weak and the adrenals are in charge of creating that immune lining called the secretory IgA antibodies that line the mucus of the gut, that's your front wave protection system. If you go in and remove all these infections out of the gut, but you have no law enforcement there, then some other, gut criminal behavior is going to move in. So you've got to also work with the adrenal gland. And that's just one example of a pairing. People may think, oh, I have thyroid problems, I need advanced thyroid testing. Yes, and the end organ of the thyroid is the mitochondria. The T4 is the four-wheel car that leaves the leaves the thyroid, gets to the cell, opens a door, so you now have a T3 that pops out. That's the engineer that turns on the dials and the switches to turn the mitochondria on. That's the engineer. But if the mitochondria, being the electricity factory, is broken, you can send as many engineers as you want. It's not going to work properly. So people may have a hypothyroid issue but they have normal thyroid levels or normal enough, but it's actually downstream mitochondrial dysfunction. So it's not as simple as saying, what test should I start with? It's really, you start with a practitioner that can analyze your unique situation and then come up with a prioritized set of lifestyle changes and labs for that are unique to you.
Yes, right. I mean, you can't just answer what test you need to take, but we do have a lot of those questions. Another questions I did get from a viewer was, and maybe Amy can start with that, when it comes to the sex hormones, and there's a lot of confusion. And often, I got this from several actually viewers is, different doctors tell me different things. when it comes to the sex hormone measuring and testing. So how do you help to unravel that, just for somebody who's really confused?
So the first thing you need to understand is that most medical providers are not trained in hormones, and they don't understand them, and so they won't test them. So you often get dismissed. So if you go to traditional practitioner or traditional OBGYN, typically is where women go, they'll say, oh, you don't need hormone testing. You're 52. It's obviously menopause. We're not going to test your hormones. And the reason they do that is because, clinically speaking, the treatment is going to be the same in their eyes, and that they know that you're old enough and you're in menopause. And so they want to push, hormone replacement therapy, and they think one dose, standard dose, because they just don't know. They're just not trained, right? So then you have these specialists that specialize in hormones, and they will test. You need to make sure that you're not just testing one time, because if a woman's in menopause, yes, you can test one time. But if a woman is in perimenopause and she's still cycling, you have to take different time periods of testing and understand what's going on. And then you can have personalized treatments, which in my opinion, HRT is fantastic if it's a personalized approach. Women feel better. They're less at risk for osteoporosis. There is no increased cancer risk according to the research that I've read. But the problem is that you're getting dismissed because you're going to the wrong physician and they're not trained to treat you. And that's the struggle. It's the same with fertility, but at least we have, reproductive endocrinologists that you can spend lots of money and go see. But there is that, that availability on that side. It's just with the menopause space, any type of hormone issue, traditional doctors, they're just not trained and they don't know what to look for. And if you don't know what to do, you don't know what to look for, you can't do the right testing. You can't give the woman the right advice.
Okay. Do you, Dr. Shay, Robbie, do you have anything to add to that?
When testing hormones?
In particular, sex hormones and the whole confusion about that. And I think especially, in menopause period, because Amy said,
So I agree with Dr. Beckley for sure. I mean, I got into functional testing in 2014 really heavily because I was so, frankly, angry at an endocrinologist who gaslit one of my patients when I was practicing in New Zealand by only running TSH when she had a clear thyroid problem. And I see this all the time where women are gaslit. Well, we ran your TSH and it was within normal bounds. And I'm like, yeah, and what about, free T3 and free T4 and reverse T3 and antibodies to thyroid peroxidase and thyroglobulin and anti-TSH receptors and like all these other things. Oh, and by the way, the mitochondria is also, a business end of the thyroid. Like there's just so much gaslighting going on. And the reason I call it gaslighting as opposed to just ignorance is that the endocrinologist was like aggressive with my patient, that you're just all in your head, go take a psychiatric drug. And so in the functional medicine universe, the looking at hormones is it is a tiered system. It's adrenals, thyroid, sex hormones. That's how we're taught in the Institute for Functional Medicine, that if you were to pick a rank order, it doesn't mean you ignore the sex hormones. That's not what I'm saying. It's that if you are under a chronic stress response, and stress is additive and cumulative over people's lives because we don't really have in our culture a methodology to handle stress and trauma that has built up over the years. But we do have a wonderful culture of how to numb out, but not how to resolve trauma and stress. And you look at the adrenals, because if your body's under fight or flight, all your sex hormones are relevant in the body's eyes because you're in survival mode. Whether it's dealing with a deadline or a tiger chasing you down, your body hormonally responds the same. So you look at adrenals, then you can check the thyroid health, and then assuming everything is healthy, adrenals, thyroid, then your body's like, great, now we can have this great sex hormone life and have pregnancy and have a great sex life as long as we're not dealing with survival and repair. So that's the lens that I have been taught and what I use in practice.
Okay. Yeah. Do you have anything to add to that, Rob?
Well, the only thing I want to respond to is really the sensitivity and the emotional aspect
Yeah.
and the pairing
Mhm.
of the patient, to the practitioner. And this comes up almost every single day in our practice, that we hear, this is what I hear, that I've been telling my doctor I'm not feeling well. He says my labs look perfect. Just go home, it's in your head.
Mm-hmm.
And they know their bodies, and women, I think even more than guys, are just tuned into their shifts and their changes because of all the hormonal things that happen just in their normal monthly cycles. And so it actually angers me. I don't know whether it's the ego of the practitioner, if it's the allopathic approach to things. I honestly don't know. I'm more in the school of where you guys come from, integrated and functional. And so we treat the whole body. We look at primal healing, concepts like that. And we listen very actively to what the way the body's, what the patient's saying, and how the body's expressing itself. So if you get a practitioner that is not sensitive to what you're saying, find one that is sensitive to what you're saying and will listen to you as an active listener. I don't know. I don't know if it's a sign of the times that people just aren't paid to care anymore. We think just the opposite. We just take a very personal approach. Everybody's unique. They need specialized approach. There may be some primal things that everybody can do that unifies their body, but then you have to dial in the specifics based on what the patient is saying and how their bodies are expressing themselves. And that's all I really have to add for now.
Thank you so much. And actually, you were saying that so much experience with that gaslighting and so much anger because of it. Yeah, and it's unfortunately common. It's a hugely common thing. Yes. So, with another question is which is a good question. We're going back into choosing your practitioners. Having an idea of what we need helps us to select the doctor. Otherwise, how do I know who to go to?
The beauty of being on summits and listening to podcasts and everyone having a website, and any clinician or practitioner that is aiming to really connect with the best possible match in terms of client and practitioner are on these summits, on podcasts, has a website, and puts out a tremendous amount of information out for free so that you as a potential client can do as much recon as you want. And you can read the ebooks, get on the newsletters, watch the interviews on summits and podcasts, and you can then, and only then, once you have fully felt like this person has the knowledge, but also the resonant personality to help you, then you can reach out. It's kind of like today when people go to buy a car, they've already researched the car. It's already done, and they just have to walk onto the lot to do a gut check to see if there's chemistry. Right? It's the same thing with the clinician. Like, it's no longer you just walk in, you don't know who you're going to meet. You do all the research you want. I mean, it's one reason why I put out literally over 100 hours of free content online between my Facebook and my YouTube channel and my website and everything else, is because I want people to know what they are getting involved with. And there's one other piece that I think I shared at the end of my talk this morning, is that if it comes down to a choice between two, three, four seemingly equally valid practitioners that could have the technical knowledge, etc., to help you, pick the one you like the most. Pick the one you like the most. And the reason why, my first bachelor's degree is in psychosomatic medicine. If you like your practitioner, you will have a better health response because of the placebo effect. The placebo effect is the single most studied scientific phenomenon in all of medicine, because they have to account for it in literally all the studies. So what that means, that we can harness that's what we should do based on the studies, not like run away from it. The placebo effect is how much you like and trust your practitioner. So if you really like your practitioner, you are not going to have this cortisol tinged glass ceiling preventing you from feeling your full health expression. I'm sure many of you have come across brilliant clinicians who have the personality of a doorstop or worse. And every time you thought of doing their protocol, the recommendation, their exercise, whatever it was, you felt this stress response because you didn't like who it was associated with. That's the nocebo effect versus the placebo effect. So if it comes down to it and you have to choice, pick the one you like the most. It's also another reason I got into stand-up comedy. True story. Don't let the academic veneer fool you. I have a stand-up comedy playlist on my YouTube channel. In fact, I have a next show in 2 weeks, less than 2 weeks here in Colorado, because stand-up comedy is, I'm trying to make myself more likable. I'm on the spectrum, can you tell? And learning stand-up comedy helps me relate to people better and engage with people and connect with people better. Why? For their benefit. Because I read the article on the placebo effect as how much you like and trust your practitioner. I was like, oh, I have to become more likable as a clinical imperative for the benefit of my clients. Like, I have to be more likable. That's an absolute. Like, okay, I guess I have to get into comedy.
Thank you for that. I mean, yes, because we maybe grew up used to be doctors being just really mean and cold, and you're here, my patient, do what I say. Amy, would you like to add anything to this subject of selecting your practitioner, selecting your doctor?
Oh yeah, absolutely. I mean, we advocate a shared care journey, and that you are the expert in you and they're the expert in medicine. And when you get the best treatment is when those two meet. So you've got to do the research. You've got to know. I tell people, write the questions down, write what you want to say. You want to post it on your notes in your phone or whatever it is. And then talk to them about it. And, you're not going to have that guided treatment unless you tell them, I came in here for this. I saw this medication or this procedure, or this is what I think it is. It might not be true, right? Like you have a physician, the medical provider that says, well, it looks like this, but I'm going to use my medical knowledge to actually uncover that it's something else. The example I have recently is I thought my son had an ear infection. He had swimmer's ear. Right? I don't know. I'm a smart person, but medical providers can do that, but you have to educate yourself. You have to understand what your symptoms are, what you're dealing with, what you want to come out of it, what your solution is. And you've got to have that practitioner say, okay, I'm going to help you. Because if you get gaslighted or pushed off or whatever it is, you hired that physician. Go find another one. There's no
That's
reason.
a great point. Yeah, this is somebody you pay for, and it's like any other customer experience. I think that's where we should go with that.
Absolutely. If you got poor service at a restaurant, you wouldn't go back. You go to a different restaurant the next time.
Great. No, I thank you so much for bringing that up. And I do want to address another question about fibromyalgia. We have a viewer asking if that is a real diagnosis or is it garbage diagnosis? Do you have anything to say about fibromyalgia? I'm not sure if this is completely...
How much time do I have? So fibromyalgia was the ultimate gaslighting diagnosis to chuck problematic, annoying patients into in the eyes of a Western practitioner. Fibromyalgia is the most brutal, dismissive, cruel diagnosis to label someone crazy, get out of my office. I developed my 10 pillars of health model precisely working with fibromyalgia, chronic fatigue, and autoimmune patients in New Zealand because they were the throwaways from the medical system. Fibromyalgia, here's a super basic overview. If your mitochondria aren't working and you can't generate ATP or electricity, then using mitochondria, which is the super efficient way to burn fat, protein, and amino acids with very little smoke, called lactic acid. It's just this beautiful process that's very expensive and fragile to take fuel and create 36 units of energy and no smoke or no lactic acid. It's a beautiful thing, but it's very fragile and delicate and can be hurt by toxicity, infections, inflammation, deficiencies, all sorts of things. And then if that system breaks down, you're only left with burning sugar inefficiently and quickly in what's called the cytoplasm of the cell outside. It's like burning. It's like the equivalent of burning, using batteries and burning paper for fuel and heat. And so you create only 2 units of energy and 2 units of smoke called lactic acid. If for the same unit, you would make 36 units of energy and 0 smoke for mitochondria. So if you were burning the same thing and you got 2 units of energy versus 36, you're at 1/18th the amount of energy available. And not only that, so that's the tired. And then you've got this massive buildup of lactic acid, which is that soreness you feel in the muscle when you work out, but instead you're feeling that soreness all the time when you're not working out. That's the pain in fibromyalgia. So to me, what I see most frequently in fibromyalgia, it's a fundamental breakdown of the mitochondria and all the hundreds of influences that go into that.
Okay, well, thank you so much for that. Would you like to add anything else, Robbie, Amy?
Well, it's missing the word syndrome.
Yeah.
Oh,
Why
well,
don't we
see, a
just
syndrome.
Thank you for that.
Syndrome. The definition of syndrome is we don't know what it is, but syndrome is code for blame the patient. That's what syndrome means. We don't know what it means. We're going to blame you. That's what it is. Syndrome means blame the patient.
Exactly. So, yeah, I love that. And, just back to you, Dr. Sam, on mitochondria, that red light, the red light and near infrared frequencies, it's actually what stimulates the cell and that whole Krebs cycle. And I think people that might be suffering from that can easily access red light therapy and find that they're getting the boost and the energy that they need. Again, jump-starting their systems and getting you back to your normal cycling. Yeah, really great. Good stuff.
Okay, great. Thank you. So we have a few minutes left. I do want to ask you about, again, just if we can go around in a circle, and we have the questions I get so much, and got the questions before in the email too about it, is that, first of all, there's a level of confusion because we are bombarded with information and people asking, so which diet now should be good for me? And we know that we need a test. We need to understand our body because everybody is different. But when it comes to women's, especially, in that period of menopause and perimenopause, what would you advise in terms of lifestyle? The first, most important lifestyle change that they should start with?
In terms of diet or in terms of menopause?
Diet and eating, this is actually the biggest problem that, we hear. It's like, what should I eat? Because I'm gaining weight. I'm in this time period of my life, and I don't know how to undo that cycle.
Okay, so diet.
I know it's a huge question, but I get it so much that I got to at least start it.
Diet. So on my website, I have a whole e-guide devoted to this, how to identify your ideal diet. It's a 5-layer pyramid. Bottom layer is genetics, is identifying your unique genetics. Are you genetically keto, paleo, Mediterranean, high carb? Do you have genetic vulnerability to specific food triggers like histamine, alcohol, caffeine-induced anxiety and depression, your relationship to gluten, lactose, etc.? Find out your genetics, which is where your ideal should be. But then on top of that is a therapeutic layer of diet. So if you're genetically keto, but you have a problem with your gallbladder, pancreatic lipase absorption, your mitochondria, your carnitine shuttle, if you take high fat, you can't metabolically handle it, even though genetically you need it. So it's like your genetics are wrapped in what I call metabolic barbed wire. And then on the other side, if you're genetically a high carb person, but you have a candida infection, you can't eat high carbs because the candida will bloom, even though genetically you do better on high carbs. Again, you're wrapped in a different type of metabolic barbed wire. And so the people who have this problem are very easy to identify. These are the people who say, I've tried every diet and nothing works. And they maybe for 2 weeks, maybe a month, but then it doesn't work because you're running into this conflict of you've got your genetic ideal over here, but you've got metabolic barbed wire, which is the exact opposite issue over here. And so the thing to do is, in that therapeutic layer, is to use functional testing, gut testing, hormone testing, mitochondria testing, everything else, to figure out what the nature of the metabolic barbed wire is and defang that barbed wire to then reveal your genetic ideal. That's the way to approach identifying your ideal diet based on testing. There's other layers as well, like personal preference. Can you access the food you want? And then there's the influence of like how you believe your food choices affect your idea of politics, environment, and the economy. And so it's a 5-layer system, but the bottom 2 are the most important. Genetics, where are you supposed to be? And then therapeutic, is there barbed wire in the way? And then use testing, genetics and functional respectively, to figure out your ideal diet.
Okay, great. Amy, would you like to add something in terms of, women who are trying to get pregnant, and if there's any sort of general guidelines? And especially, I've spoken with somebody recently who went on this strange journey trying to lose weight after baby, and then getting on a diet, and then she wouldn't have her cycle back. So what would you say, what would you advise women in that kind of struggle, trying to lose weight, not knowing what kind of diet to be on, and yet, maybe trying to conceive again?
It's tough because there's a lot of metabolic disorders that can affect, or syndromes, so to speak, that affect it. The biggest one for fertility is PCOS, or polycystic ovarian syndrome. And this is where your ovaries, as well as the rest of your body, are not as sensitive to insulin anymore. And so it's harder to ovulate and make hormones. And so you have some imbalances. These also, because you are resistant to insulin, you typically, gain weight, and the weight kind of stays on. And so, hormones are not the only thing that affect weight, but if your hormones are not regulated properly, then you absolutely can put on a lot of weight. The pregnancy hormone is called progesterone. It's produced after a woman ovulates. And some of the main things that it does is it helps a woman during pregnancy. It slows the digestive tract so that when you eat food, you pull out more of the nutrients, because it feels like that you're pregnant, you have to pull more of that out for that growing fetus. And so a lot of women start to feel more hungry in their second half of their cycle. And so, you can get these eating patterns. And so this whole idea of cycle syncing and eating according to your cycle, your body needs different foods and different nutrients at different times of the cycle based off of what hormones are produced. So, after ovulation is a good example. After ovulation, you want to eat really, really protein-rich foods, and lots of vegetables, because those are going to be high fiber and they're going to be more satisfying. And you won't feel as hungry as often. Whereas in the follicular phase before ovulation, you really want fresh foods, fruits, salads, those kind of things, seeds, nuts, those kind of foods to help you fuel the energy of the estrogen surge. So, I think hormones are kind of down low on they're like they're not the cause, but they're the effect, right? And so something's causing your hormones to be off balance. And so just trying to balance hormones, you really need to look at the root cause as well. And some of these are genetic, so kind of starting, I like the pyramid idea, kind of starting at the top and understanding everything in your body is really going to help you.
Okay. Wow.
I just want to add one thing.
I wanted to ask if you had something to add. Mm-hmm.
Well, in my experience, first off, what Dr. Sam was talking about in understanding the epigenetics, your genetics, and what your proclivities are in food choices is super important. There's, religious and ethnic and holidays and what you're accustomed to doing that may not necessarily jive with what's best for you. And so you have to break that cycle a little bit. I've, in my own personal experience, we intermittent fast every day. We have for more than 20 years, my wife and I. And fasting in general is like a hard reset. So when you're trying to shift from whatever your old habits were to the new change or whatever you're looking to do, taking a couple of 3 days and just doing a simple water fast, again, under the guidance of your practitioner so that you do it in a healthy manner, I think is a really nice way to allow your body to, get sort of reorganized, take the stress off of your organs that are working hard to digest food. Now they don't have to worry about that. And you can kind of recycle all the junk that's been inside of you to get you into a new phase. The other thing that I think that's worked very effectively for me is not get stuck in one mold. Like my wife and I were basically plant-based for almost 15 years in our diet. And I was experiencing some inflammation. And so I shifted to a modified keto diet. And whatever you're going to do when you shift, it takes about 21 days. You have to dedicate at least close to a month for you to get that metabolic shift to actually, for it to kick into gear. So most of these diets will work, but if you only do it for a week or two, you don't get enough time for your body to actually shift into gear. So whatever you're going to go, wherever you're going, just commit at least 21 days to get that full experience. And then just see how your body reacts, you know, be tuned into what you're experiencing, and then see if it's good for you.
Okay, wonderful. Well, so thank you so much. We are out of time today, but thank you, Dr. Shay, Robbie, and Dr. Beckley, and Amy Beckley. We're looking forward to interviewing you on Sunday. So everybody who's watching, please come back. Definitely, we're going to be talking about everything about fertility. So I want to thank you so much for attending, and thank you everybody who posted and asked questions. Come back tomorrow for another Q&A at the same time. So just get your questions ready, okay? So it was a pleasure to have everybody, and I know we're just touching upon all those subjects really from, you know, a little bit, but like I think like Dr. Shay said, you know, attending these summits, these events, educating yourself, this is the
Love
first
that.
Nobody out there is to come and tell you what to do. And, you know, we have to start somewhere. We have to start right here. So this is why we're here for. And I so appreciate your, you know, helping this along. So great. We'll see you soon. Thank you so much.
Thank you, Monica.
Great.
Bye.
Thanks for having us.